This is Dr. Nikki Saxena,
And Dr. Eileen Chan.
and we're talking to you today from Pediatric Wellness Group in Redwood City, California. Today we'd like to talk about the use of medications in pediatrics. Medications such as antibiotics, medications for illnesses like reflux, even medications we don't even think of that are in our homes every day, like Tylenol or Motrin. And there's been a lot of publicity, there's been a lot of internet blogging about when to use medication, when not to use medication, when is it appropriate, when is it not appropriate. And basically both Dr. Eileen and I feel very strongly that as with any drug, you need to know why you're using it and you need to use it in the appropriate situation.
Parents are often asking us things like, when do we use medicine? Do we have to use this antibiotic? And we try to be very judicious about the use of medications in your children. We don't want to use an antibiotic for every runny nose that comes to us or every fever. It's very important to see your pediatrician to make sure that when we do use a medication such as an antibiotic, that we know why we're treating with the medicine. We talk about when we expect symptoms to improve, and we'll talk about what specific antibiotic to use for each indication.
Sometimes people will say, do I have to use this medicine? Sometimes we'll come in, we'll do everything right, we'll have a conversation, we'll look at your child, we'll examine your child. We like to go over everything together with parents. We want this to be a decision that everyone feels comfortable about. And sometimes there are situations where we'll say, you know what, maybe you can wait a day or two. It really becomes a very child-specific, situation-dependent decision, and that's okay. What's really important is to have an open conversation about this with your pediatrician so that everyone feels confident that whether you choose to use antibiotics or medication or whether you choose not to, everyone's on the same page and everyone knows exactly why or why not. So, I hope that helps. Hope you have a great day, and we'll talk to you soon.